Good afternoon, everyone. Welcome to Fertile Talks podcast. I'm your host, Dr. Yemi Famuyiwa. I want to talk today about a topic that comes up very often in my office, and that is when patients are deciding. They're deciding to come in. They're deciding to seek answers. They're a little curious. They've heard about maybe taking vitamin supplements. So they decide after reading and maybe after following some TikTok videos that they want to take supplements for 6 to 8 weeks before they do anything. And then they may have heard that let me take this off for a second. They may have heard that, some certain nutritional supplements may work. So then they go and they scroll and they find these supplements and they start consuming it. Then they decide they want to do a Mediterranean diet and they're going to go out and they're going to follow the Mediterranean diet. Or they want to get their BMI just one notch down and then they decide they want to do whatever detox they may have heard about, or they decide, well, I'm going to take some more notes. But do you see a pattern in all of this? They're deciding and they're deciding and they're getting ready to get started, but they don't get started. And before they know it, it's been months, it's been years, and by the way, this has nothing to do with patient's level of understanding because I actually have seen this in some of my patients that are physicians. And maybe they finally get out and they knock on somebody's door or pick up the phone and ask a few questions, but maybe they didn't quite hear what they expect or they didn't feel any connection with the first place that they called. So then they get discouraged and they go, well, maybe this is not the time. Maybe I'll put some more time off and I'll look around some more. And so then they wait. And this is actually a true story because a friend of mine, when I asked her, why haven't you frozen your eggs? And she goes, yes, I did reach out and I just didn't feel like they understood me. So, yeah, and then I got busy and yeah, and then they said it's going to take a lot of time and I have to come to the clinic every day. And gee, I'm so busy. I'm starting this beautiful practice. I don't have time for that. So then it takes another 2 months, another 3 months, another 6 months, another year. And then I'm like, but look, now it's been 3 years, and really my heart goes out to these women, and I know so many of them actually, and I'm here to tell you there comes a time when trying to decide or preparing is not moving you forward. There comes a time where you have to pull the plug, so to speak, and reach out and get adequate information for what the next step is. And let me encourage you, if you go to that first place and you just don't feel that they received you well, don't give up. If you finished medical school, you've been through harder than that. You've been through ups and downs. You've put in your best effort. You've slugged through the call shifts. You've presented. You kept standing back up. So don't stop because the clinic that you went to did not connect with you. You need to find your tribe. You need to find the right place. You need to start taking the first step to do even the basic of test, to go out there and get your hormones tested on the second or third day of your period, to go out there and get an ultrasound done to see even if you have some follicles and how many follicles do you have. And please don't be discouraged. And if you're discouraged, send a comment to me. Let me encourage you. You don't have to come to see me. Let me give you that. Maybe today you're listening to this for a reason. Maybe I'm going to be a positive booster in your whatever journey you're on. But there comes a time where I encourage you to try to take the next step. Take that first step. I always tell patients the very first step sometimes is the hardest step, because when you do start, then curiosity takes over. Then you want to see, okay, wow, what's behind these numbers? What would this really mean for me? And maybe I can really try to work with them on my schedule and try to work, something out with the clinic. But can I encourage you? Don't give up. We know time and again that in fertility, time keeps moving forward. And I guess one of the things I see too is when you wait, after a while, that builds its own kind of pressure. And I give you an instance. It's like me. You can tell her when I said this, but I hadn't seen my dentist in a little while. And then I thought, oh my gosh, then I have to go see her, and then she's going to give me a word or two about not coming in. And then I thought, and then I thought, and then I thought, and then I didn't go. And then finally I went, and I was telling her that, yeah, I knew I should have come, but I was starting to feel bad, so I didn't go. Does that make sense? So don't let that be you, right? Um, Take some small steps now. Find out what the simplest thing you can do to move forward, because I encourage you, that very first curiosity step is like its own positive booster. and and I encourage you to take that step. Send me a comment. I'll pick you up. I'll cheer you on. I'll be your I'll be your Rara fan club to say, please take that step wherever you may be, wherever whatever part of the world you're in. Don't let fear and hesitation stop you. We're out here to help you. That's what we're in this for. We want to help you, right? So it doesn't have to be me, but there are other fascinating doctors out there. I have friends all over the country. You can reach out to me and I can connect you with them if they're local to you. But let me encourage you today, take that first step. Just take the step. Make that first phone call. All right? Till next time, when I see you, and just a little shout out, a lot of you listening to this are not yet subscribing. If you want to help us out and help us spread our message out to more people, just hit the subscribe button, or better still, share it with your friend group, right? We're all out there. Share with your friend group and spread the word. Fertile Talks with Dr. Famuyiwa is here to help and support you. Thank you and have a good day.